I'd like to start by thanking me for arranging this outstanding evening in Galway. I've just seen the meeting and the room is full. It's fantastic. Congratulations. Well done job. A lot of people knows me and some people don't know me. I'm the surgeon who was about to be gagged by certain organizations that don't talk to you. But you know me, they can't keep me quiet. So that was 5 years ago, and I'm still standing, and things are changing very rapidly. So today I'm going to change everything that you have learned over the past maybe 50, 60 years, and I hope you'll understand where I'm coming from. Some of it is purely science, and some of them is trying to break the ice with you.
We live in a fallen world. But just because I breathe corrupt air and rub elbows with corrupt men, never make the mistake of thinking that I am corruptible.
I won't make that mistake.
It's very clear that we have major problems with the regulators. I did not employ any of the 36,000 published articles that any of the authors had acknowledged receiving funding or research education grants from any pharmaceutical industry or an employee of the following, and you could read all of them. And I've tried to avoid any of this to show you exactly the trial of defrauding the whole medical industry and trying to deceive you. And I couldn't find better than what's been put in the New York Times is FDA on drugs, because I couldn't believe it.
We've been told that medications to lower cholesterol will save lives.
We repeatedly hear from patients that their doctors tell them, if you don't take this, you will die.
Over 40 million people worldwide take drugs to lower their cholesterol. But now there's evidence that the majority of them won't benefit.
None of those people are less likely to die.
Of course they're going to try to minimize the adverse events because that will increase the sales of their drugs.
In its effect, it's certainly scientific fraud, and in its effect, it's organized crime.
So what's happening and the big change that happened over the past few years, that's Ansel, the guy who have created the havoc in '61. The reason for that, Eisenhower died, and he was beloved by a lot of Americans, and they need to give a reason. So they met with everybody. Let's see, is it sugar, is it tobacco, or is it fat? Tobacco, big lobby, they couldn't go against. Sugar, the biggest lobby in the United States, they couldn't go against. So who, the poor guy, is fat? Let's kick the can down the way. So fast track, another 30 years, comes in '84, and they put this in front of the Time magazine. Your egg, which is the best thing you're ever going to eat, the choline in it could cure 99% of your problem by inflammation. However, people are afraid to eat it. However, thank God we got a little bit of sense, and in 2014 said that, sorry, you must eat good better is good for you. It took the time, 53 years, to acknowledge the mistake that they created. We are observing the revealing of the utmost medical tragedy of all times. Never before in history had the medical institution deliberately produced a life-threatening nutrient deficiency in millions of otherwise healthy people. Any negative studies on statins are discouraged, and critical researchers are blackmailed. And I myself, all my research fund from the multinational was cut because of my outspoken way about statin.
I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them. In the middle of my 2-year illness, I saw my internist for our annual check. After briefly noting that I was seeing several specialists for my dry eye problem, my arrhythmia problem, my colitis problem, and my depression, she then got to the heart of the visit, which was that she was delighted that my cholesterol levels were under control. I find it ironic that neither she nor I ever stopped to question why a relatively young, healthy person had suddenly developed 5 new illnesses in 1 year. And the only new thing in my life was Lipitor.
So it's not you alone. This is a doctor, a very highly qualified doctor. She was seeing 5 specialists. And the problem is somebody gave her a tablet for primary prevention. If we start looking about what's going on and what's happening and association between statin medication and mortality, what we have found that statin use is a marker for quality of access to care. She's a doctor. She accesses anybody she likes. She goes to the top physician, and what you do, he prescribes medication. So her side effect of her highly socioeconomic status worked against it because access to care. My history of starting about statin is my first publication about diabetes in 2006 in the European Journal of Vascular and Vascular Surgeon. And what we discovered at that time that diabetic patients do very well regardless what you do for them. Is the people who haven't been diagnosed with diabetes but they have this abnormal gray area between HbA1c at that time between 6 and 7.5. They do worst of everything. And we didn't know exactly what's going on and what's the prognostic significance for these patients. And then at that time I dig deep and I published the first thing in 2008 and I've said that homocysteine, the cholesterol of the 21st century, and I've told them that cholesterol is nothing. The problem is hyperhomocystinemia. We're attacking the wrong guy. And they said, no, you just have 2008, remember that. Then after that, I went in 2012 and I've showed them that by giving the patient only vitamin B complex, you get it over the counter. You don't need to get a prescription for it. I was able to get all these patients in the best available form without giving them anything else. And they've been published in the same high impact GVT journal. And I've told them very clearly that the problem is not cholesterol. Then started looking at the risk of incidence of diabetes with intensive taking statin, and at the same time looking at the effect of statin on fasting glucose level and the incidence of diabetes in patient who's taking statin. And it was amazing when we looked at it. Whether you're taking Lipitor, Crestor, Zocor, all of them increase the risk of new onset diabetes by 4-fold and is irreversible. You get that, you switch on the gene for it, and that's it. You are on a point of no return. And render current diabetes melts uncontrollable. Some of you will be pushed to go on insulin and still uncontrollable. 1 of 3 women will develop diabetes if they use a statin, regardless of their age. Now, other problem is erectile dysfunction. If you're a male above the age of 40 and you're taking statin, and then you have erectile dysfunction, first of all, you have a problem with your wife because she thinks that you have an affair. Second, which is much more important, that you're going to start taking prescription for Viagra or Cialis, which doesn't work, and you'll be so depressed that you have lost your manhood. It's the tablets that you're taking. Primary prevention in a healthy guy like this is killing your testosterone level. It's transferring you from a man to a wimp. Why? Because you're taking a tablet. Now, if you look at rhabdomyolysis, if you are athletic and you jog every day and you're taking statin, your creatine kinase will go up and you'll end in renal failure. And it's creating more and more problems. And statin increased muscle fatigability by 30% with 11% incidence of rhabdomyolysis at 80 milligrams of Lipitor. This pain lasts for 12 months. So you stop it, it will decrease. But in order to abate completely, it takes up to 12 months to disappear. We went on and started looking at statin therapy in vascular patients. And we have seen that it's associated with an increased amputation-free survival without improving the salvage rate of the affected limb. So what's going on? There's something happening in this patient. So I'm going on after all the guidelines, I'm giving the statins, but still I'm not getting the result that I thought I was going to get. So we look at what other things that happen with statin, and we find that, and this is cut and paste from the publication, statin was associated with significant increased risk of colorectal cancer, bladder cancer, and lung cancer. So you take a tablet of statin, and 2, 3, 4 years down the line, the patient comes to you with an unexplained cancer. You look at the CT scan before that, it was normal. Then you look at it now, we have a problem. So we start investigating this in a much more detailed way. And what we find that it induces what's called necrotizing autoimmune myopathy with immunosuppression. And the outbreak of this huge number of squamous cell carcinoma in the skin that goes to our colleagues, the plastic surgeons that increase their productivity during surgery have increased. And the reason for that is that squamous cell carcinoma side effect of statin that have been excluded from all industry-funded trial. Now we're talking about stroke, and Marie, who said about that, and I'm sorry to hear about your dad. And I'll show you something very interesting. That stroke, that's the biggest high-impact journal. It's called Stroke. And they done a Sparkle trial, which was fully funded by Pfizer, and basically said that if you get a stroke, you must take statin. And everybody went on behind it. Get stroke, take statin. So this is in the published in the Arch Neurology, which is a higher impact than stroke. Statin use following end-cerebral hemorrhage. And the findings was avoiding statin yielded a life expectancy gain of 2.2 quality-adjusted life year compared to statin use. Gain, avoiding statin. Then after that, they found that annual recurrent risk of MI would have to exceed 90% to favor statin therapy. Remember, they're analyzing the same data that had been published by Pfizer through the Sparkle trial. And then what they found is that modeling of statin therapy under various secondary prevention scenarios suggests that a net benefit for avoiding statin, please don't touch, is dangerous. And the last thing, which was very interesting, that similar statin-associated increased risk of brain hemorrhage in those with a history of ischemic or hemorrhagic stroke. So basically, that if a patient gets a TIA or transischemic stroke or mini stroke and you give statin, you're increasing his chances of having an intracerebral bleed and another stroke. To which all of you know that if you get a TIA, you go to the hospital, the first thing give you an aspirin 300 milligram and a statin tablet. And that's the evidence that a lot of people don't know about.
We frequently forget that cholesterol is essential for life, and that a little higher cholesterol is associated with longevity, decreased malignancies, improved defense against infections. So when you lower cholesterol by any means, you can have adverse effects just from that.
So at least the FDA is starting to wake up a little bit, and this is on the 24th of October of this year. They expanded the warning that statin could cause diabetes, memory loss, and muscle pain. At least they have started to have a little bit of conscience. So what's happening? Before 2004, everybody used to publish whatever they want and nobody could ask another question. And this is what Azim was talking about, the fraud in publication and the bias. After 2004, there's much more tighter restriction. And that's why all randomized control trial after 2010 showed that statin drug treatment doesn't reduce coronary calcium score. Worse, the statin treatment showed progression of coronary calcium score indistinguishable from the non-treated placebo group. So definitely, we are facing a major cover-up story. Now, the first guy is Sir Richard Thompson. I know him personally. He is the president or ex-president of the Royal College of Physicians in England. And he is the Queen personal physician. The Queen now is currently 91 years of age, and thank for him, she's not on statin. Now, Claire and David, both of them are very active, and they're very, very astute, and they try to change the big industry in the UK. And Simon Campbell, to which Azim have mentioned his name, the four of them have written a letter to this ugly guy, who have listened to these guys and changed the NICE guideline. And they told him in the letter basically that they're trying to do medicalization of healthy individual. They are hiding the true level of adverse event. And there's industrial bias, there's loss of professional confidence, and there's the conflict of interest was very clear. And in the letter, very clearly, they urged to withdraw the current guidelines on statin for people at low risk. So typical. He replied back, we have the evidence and all the experts agreed that I must not change our stance.
Studies have consistently shown that cholesterol-lowering statins actually increase the amount of calcified plaque in the arteries. Ironic for a drug that's supposed to prevent heart disease. The Veterans Affairs Diabetes trial found that more frequent statin use was associated with accelerated coronary artery calcification. Another study published in the journal Atherosclerosis found that statins also increased the amount of calcified plaque in healthy people without diabetes. And yet another study published in the Journal of the American College of Cardiology found similar results. These studies have been quietly ignored by the medical establishment and the mainstream media.
Statin is the causative in coronary artery calcification as it inhibits the synthesis of vitamin K2, the cofactor for matrix GLA protein activation, which in turn protects arteries from calcification. That's the mechanism. Statin function as a mitochondrial toxin that Bob was talking about today that impair muscle function in the heart and blood vessels through the depletion of coenzyme Q10 and Hem A. Statin also inhibits the biosynthesis of selenium containing proteins and glutathione peroxidase serving to suppress perioxidative stress, which is the main cause of congestive heart failure and dilated cardiomyopathy. That's why there's an epidemic, in fact, of congestive cardiac failure. The epidemic of heart failure and atherosclerosis that plague the modern world is aggravated by the use of statin. And I'm going to show you in a very simple way what's going on. So that's statin. It goes in and starts to prevent acetyl-CoA transfer to phenyl intermediate. When this happens, you increase the lunastrone. That's why we have a huge amount of people coming with cataract and blurred vision. That's one of the reasons. And then kill the coenzyme Q10 and affect the vitamin K2 and the dolicol and the RAB. When this happens, you insulin resistance increase, insulin secretion decrease, you have increased arterial calcification, increased coagulability, and decreased energy supply. And all of that give you to cardiovascular disease, diabetes, and cancer. So that's the problem. That's the scientific analysis of what's going on. Much more than that, if we add over their warfarin and going every way to Kentucky Fried Chicken or eating fish and chips every day, you just roasted, gone. There's no way back. So that's the three major problems that's affecting you. So this is a publication from Japan, and statins simulate atherosclerosis on heart. Again, statins are capable of increasing congestive heart failure, early onset of diabetes, carcinogenicity, tetragenicity, central and peripheral nervous disorder. People that tell you that I have a boiling hot leg at night, the peripheral neuritis. Everybody have this problem. Ask yourself, are you taking statin? There's a major warning from the FDA 2 years ago that this peripheral neuritis is a side effect from statin. Now, all are apparent after 6 or more years of statin therapy. So it's the more you take, the more damage it's going to cause for you. Now, this is a publication last week, just out of the oven, and it's very clearly stated that first to evaluate statin-induced diabetes randomized control trial. The whole idea was you take statin, it protects you against diabetes, protects you against everything. So they done a randomized control trial to see whether this is happening or not. First level evidence. And what showed that statin use is associated with a 30% increase in diabetes in normal people. However, high-risk people, it pushed them beyond controlled idea. So it does not protect, in fact, it induces diabetes. So if you look at epidemiological studies that's happening currently and what we need to do, over there we know that positive association between cardiovascular disease and diabetes and its causal relationship is unknown. However, the new thing that we know that is this: inhibition of vitamin K2, dependent process, enhanced inflammatory tone, give you this three major problems: cardiovascular disease, diabetes mellitus, and cancer. And that's because you stop the whole idea of neutralizing this.
In essence, where cholesterol levels are concerned, many studies have shown the higher, the better.
This is the meta-analysis of Japanese 5 reports showing the relationship between cholesterol levels and all-cause mortality. In men, it's just this trend, and in the women, there's nothing here, but if your cholesterol levels are very, very low, then your chance to die is bigger than than the other groups.
Professor Hemorrhage and myself have published few papers. This is a guy who you could say that dedicated himself for his patient. Unbelievable. And his finding is, I have to say that he changed a lot of stuff. That's from his study. And participant at age 35 to 70, so it's almost everybody in this room, treated with a low dose of somatostatin, which is the lipostat, for 6 years. As you can see here, if you go below 200, you could see your chances of dying, cancer, stroke, and heart attack increases dramatically. And this is, you have to avoid that. Medicine and vegetable oil as hidden cause of cardiovascular disease and diabetes. Statin-induced suppression of cholesterol biosynthesis cause accelerated atherosclerosis, heart failure, and cerebral bleeds. Statin and warfarin share in part a common mechanism to inhibit vitamin K2 dependent process, which lead to increased onset of cardiovascular disease, diabetes mellitus, chronic kidney disease, bone fracture, and mental disorders. This is two back-to-back about the vitamin K and what's going on currently for vitamin K, and the most important, that an increase of vitamin K intake is associated with reduced risk of cardiovascular cancer and all-cause mortality. And again, in here to tell you exactly how this happened, evidence that vitamin K and its derivatives can be used as a cancer therapy, especially for prostatic cancer. And I could see that Professor Sultan sitting over there, and I think that it's nice to start using vitamin K as an analog. This is just published 2 weeks ago in British Journal of Urology, and you know better.
It's a major criticism that has been raised against using statins for primary prevention in completely healthy people. I mean, we are all going to die. And if we don't have some certainty that by taking a drug for decades, we will expect to live longer, and when we don't know really what the harms are, because they're always badly reported, then we have a problem.
Do cholesterol drugs do any good? And in fact, it increases your cancer rate. And the effect of statin on average survival. And in here it was very clear, the median postponement of deaths for primary and second prevention trial were 3.2 and 4.1 days respectively. So you could be unable to walk, you forget the name of your wife and your bank account at the same time. You don't know exactly what's hit you, but you're going to live an extra 3 days. It's amazing, isn't it? Now, prescribing statin for cardiovascular disease in the old, and the old by the definition of World Health Organization is above 60. 60 is the new 40, just to make things clearer. 70 is the new 50, 80 is the new 60, 90 is the new 70. So do not discriminate yourself against age, because things have changed dramatically. No scientific evidence for the use of statin in primary prevention or patient above the age of 60. And in fact, in this publication, I was shared by myself and my esteemed colleague, Dr. Azim Al-Harta in it. Children. It's a problem that you take your child, you go to your GP, and you're so happy you're going to take blood from the child with all the phobia of the needle, and then he phone you back, his cholesterol is 6.5. We need to give him something. Please stay away from our children. There's no scientific evidence, and if you're going to do that, I think you're not a good parent. Change the lifestyle. Don't give statin. It will destroy his life. The first thing in kids taking statin is depression. Be aware of that. There is no guidelines, and there's no way. Government report. There is evidence of selective reporting of outcome with failure to report adverse event or inclusion of people with cardiovascular disease. There is no evidence that primary prevention with statin is cost effective. Any expectation for statin use have been not met. Instead, they have found a pattern of overestimation of benefit and underestimation of harm.
Another concern relates to the actual definition of high cholesterol. Just a few years ago, a total cholesterol level above 250 was considered high, but this threshold has now been lowered to 200. These guidelines originated from an expert panel of the National Heart, Lung and Blood Institute in America and were adopted by several other countries. The lowering of the threshold, effectively changing the definition of high cholesterol, meant that millions more people became eligible for statin medications. This raised controversy because 8 out of the 9 experts on the panel had financial ties to the pharmaceutical companies that make statins.
This happened for a reason, because the sales of statins started going down and they need to introduce a new drug. This time, we are not looking for cholesterol. Let's look about something different. Let's look at LDL. Try to get only the LDL so that you don't have the side effect of statin. Or let's give a drug that increases the HDL. So in order to do that, they need everyone to be eager to be treated. So what they went in a lovely meeting like this, in a lovely place like that, got a few guys in the room, give everybody good checks, and said that, look, let's cut it down. Normal cholesterol level originally was between 4 and 7. I don't know how they dropped it now to 5, but this is the whole idea. So they started talking about it. However, thank God there's the like of good people who have published about the ILHAT. And ILHAT say that there is no, even if you reduce the LDL, there's no change in mortality in the heart. And the benefit, because it was the only major non-industry funded study on statin done to date. And then came in the new conclusion about ILHAT, which was published last week. There was no benefit was found when parvacin was given for primary prevention to older adults with moderate hyperlipidemia and hypertension, and a non-significant direction toward increased all-cause mortality with parvastatin was observed among adults 75 years and older. Basically, the guys told you, take statin, you will die. That's basically it. And the reason that they were so honest, because all of them, non-industry sponsored trial. In Queen English, the lower your cholesterol, the shorter you live. Now, this is got it from the Lancet. And as you could see in it, this is lesson learned from Pfizer. Pfizer had a big building in Cork done for something called Eliminate study for a new treatment called SEPT inhibitors. However, the study failed. So in order to wash their hands and look as good guys, they have volunteered to give that building free for the University of Cork. Take it. So that they do not publish the Eliminate study. However, as you could see in here from all of that, the way that supposed things going to happen, and that's why they have changed the measuring, is what's going to happen over time until they go and reach 2012. However, God was watching. New England Journal of Medicine, Eliminate trial failed, stopped, sold. In fact, they sold it to Amgen, who are trying to get it back in a different way. As Asim said, that they're trying to change it in the other way. So they sold this to Amgen, a private company, a subsidiary of Pfizer, tried to get it back last in the Fourier study that you're going to talk about. And then Roche switched off everything for Sept. And then after that comes the latest one, trying to get it through, and the Reveal study, which didn't work. So any attempt of increasing HDL or lowering LDL with SETP had failed dramatically.
Australia's National Heart Foundation is examining new American guidelines for cholesterol-lowering medication.
The new guidelines greatly expand the number of Americans that would be eligible to receive statin drugs from about 36 million previously to as many as 72 million now.
However,
Paul Ritger and Nancy Cook of Brigham and Women's Hospital looked at published studies of patients with cardiovascular disease and say the new calculator significantly overestimates the risk. The calculator may suggest statin treatment for about twice as many middle-aged Americans as actually may significantly benefit from it.
One of the recent articles in the New York Times showed that 12 out of the 15 panel group are affiliated with the industry.
The drug industry buys influential doctors. And these doctors are allowed to sit in guideline committees.
So let's see about the evidence about what's going on in heart. This in 2010, and in here they tried to see the CATP versus normal risk factors. So through normal risk factors, you have no problem. If you take this medication, you increase your stroke rate, heart rate, cancer, and sudden cardiac death. Basically, it's associated with increased cardiovascular and all-cause mortality, challenging the rationale of pharmacological SATP inhibition. Then comes after that a big paper published in Atherosclerosis, and in it tried to see biomarkers that fulfill the prediction of the problem. And they found the biomarker that fulfill most of the criteria and considered clinical surrogate endpoint for cardiovascular disease was carotid ultrasound, ankle brachial index, and pulse wave velocity. However, biomarkers that do not present or fulfill any essential criteria for diagnosis of cardiovascular disease are LDL and HDL. That's atherosclerosis guys. All of them are cardiologists, epidemiologists sitting in a respectable room. So what are you asking about my cholesterol? It doesn't mean anything. Stop having this problem or phobia about cholesterol. It's not your enemy. Now here, this is just published last year, again in Annals of Neurology, SEPT increased the HDL and lowered the LDL, but it induced catastrophic cerebral bleed, and it was stopped trial, and there's a warning now not to be given to anybody. And again, in clinical pharmacokinetics, what's happening? So this is the 4 names, and all of them with a T, A, E, or D Tarapib, all of them are SEPT inhibitor, were evaluated in phase 3 clinical trial. All had cardiovascular events, cancer, sudden death, unexplained higher mortality. And comes the reveal, which has just been published last Monday. Higher blood pressure when you take it, which I think some cardiologists said, okay, what about the blood pressure? But major adverse clinical event from everything, whether cancer and cerebral bleed, arrhythmias. The most important that the people who took the sugar pill, the placebo, have done far superior than the people who took the very expensive drug. HOPE-3 is a negative trial, just been published last August. And when it comes to possible benefit of rosuvastatin, which is basically Crestor in terms of statistical and clinical significance, and show that how evidence-based medicine is hijacked. And then the last one was the PCSK9, which is the FORIA that Bob is going to talk about tomorrow. And that's the problem. I will not go in it in deep, but I'm telling you one thing. Remember, this was under Pfizer, given to Amgen. Amgen losing money, they want to go out, so start manipulating. The number of deaths had increased. A stop trial as 444 died in the treatment group, but only 4 to 6 in the placebo group. So definitely, the placebo group was far superior. And it required very close to $14,000 to be given per year an injectable form. So you need to pay $2 million to prevent 1 heart attack. Is this justified? Now, this is one of the nicest paper that I have co-authored with Asim in British Medical Journal, and it was all over everywhere you could go in. And basically, you find that elderly people, unfortunately, this is by definition of WHO, not me, is anybody above the age of 60, with high LDL live longer than those with low LDL. Our analysis provides reason to abolish the validity of the cholesterol hypothesis. Our study provides rationale for scrutiny of guidelines recommending pharmacological reduction of LDL.
There should be changes all over the place. We need a revolution. It's not enough with reforms, because the whole system is so rotten that we need a revolution. And one of the first things is that doctors should look at themselves in the mirror and ask themselves, can I really defend accepting money from a corrupt industry? Which business model is organized crime that has caused the death of hundreds of thousands of patients over the years? Can I really accept to get money from an industry like that? I think the answer is very simple. You must say no.
So for the future, this is my prediction and what could happen. We will have tablets to increase your cholesterol, tablets to increase your LDL in order that you don't develop infection, cancer, weakness, give you a lot of stamina and a lot of better life. The lipid hypothesis created the war on fat and cholesterol, which commanded a 53 years of global human experiment that's currently being acknowledged as an awful failure. This was an experiment that has atrocious unbearable, dire, nasty, shocking, repulsive generation consequences. The ugly side of statin, the unknown, and the whole idea of what's going on currently. And I need to tell you that cardiovascular primary prevention through lifestyle changes and abstaining from sugar, tobacco, and alcohol will enhance clinical efficacy and quality of life over any pharmaceutical or conventional intervention. And the only thing, if you could remember out of my talk today, statin is contraindicated for any patient over 62 years of age, any woman, and all children. Thank you so much for listening.